Well, like it or not, we are all still living with the threat of the coronavirus, though now it has many concerned about their health on other fronts. KCTV5's Carolyn Long looks at how to make some tough decisions as resources are still spread so thin.
Right now, the medical community is looking at patients in two general groups. Those undergoing active treatment for a chronic condition. For them, it's vital they maintain their treatment schedule while minimizing the risks. That's clear. But the other group is much more gray. What are you to do if you're scheduled for a routine visit? Is that risky, or should you delay it?
You know, it's the big C's. It's the cancer question or it's the coronavirus question. How do you answer that?
Claire Otto is the assistant news director at KCTV5. And she was faced with this very dilemma. You see, she is one of 14 children in her family and now considered high risk for breast cancer.
I've lost a mother and a sister to cancer, and I watched them die, and it was terrible.
Other forms of cancer also hit her father and brother, so she goes in for an MRI, ultrasound, or 3D mammogram every 6 months.
For me, I can't let this go. I have to do something about keeping track of my health.
I think in situations where you're getting follow-up scans, it's a little more complicated.
We asked Dr. Timothy Pluard, the medical director of St. Luke's Cancer Institute, how to handle these visits during this time of increased COVID-19 concern. He says it's all about balancing the risks.
If we're individualizing those situations, trying to defer as many of those as we can, to try and minimize the risk for patients coming to a hospital clinic setting.
In addition, he's trying to minimize the risk to the current patients and staff.
And I'm thinking, do I do it? Do I not do it? How does that work?
For Claire, they determined that even in the throes of a pandemic, she simply cannot put this off.
Then my nurse practitioner's assistant calls and says, we're going to keep your appointment, Claire. She goes, because you are who you are, you're special. We're going to keep your appointment.
For many of these patients, their cancer probably a greater risk than COVID.
So Claire made an early morning appointment, normally a hectic time of day, but not this time.
It's a little bit like an alien experience. The hospital is vacant right now.
And she'll probably encounter a lot fewer people, which is the intent.
I was the only person in the waiting room.
Then everyone who comes in is actually screened before they enter the cancer center with their temperature and symptoms, and then they're given a mask, and they're masked for their entire duration of their visit.
It was strange. It was very strange.
Strange maybe, but it's a godsend she went. They did find something that could have turned troublesome over time.
So I had 2 needle biopsies. One situation, no big deal. The response back was, I don't have cancer, which is like, but I have something that has to be taken out.
Unfortunately, the doctor tells us these types of balancing questions will have to be asked until we can safely say we have conquered the coronavirus altogether. Sadly, we are not there yet. Carolyn Long, KCTV5 News.